Thank you for your interest in our curriculum. Whether you are a new faculty member, student, or staff member, someone thinking of joining us, or simply someone interested in learning about what's going on in medical education, we hope that after watching this presentation, you'll have the basics of what and how medical students learn here at Florida International University. Florida International University, Herbert Wertheim College of Medicine is South Florida's only public medical school. Created in 2006 amid pressing community health concerns and a projected critical shortage of physicians nationally, the Herbert Wertheim College of Medicine is developing a curriculum that reflects an innovative 21st century approach to healthcare and medical education. Here is a curricular overview. First, let us clarify something for those of you who think about medical school in terms of years. When we refer to the different time segments of medical school here at HWCOM, we don't use the terms first, second year, third year. Instead, we use the term period, which mostly, because of a short period one, doesn't quite match up to years. Period 1 refers to the first 8 months of medical school. Period 2, which is a full 12 months. Period 3, another 12 months. And finally, period 4. As you can see on the graphic, period 1 begins in August and the first set of courses are completed in March. These are mostly classroom-based courses. The start of period 2 begins in April and ends in March. It is mostly focused on classroom study. In the third year, students begin in April and complete what are called their core clerkships. During period 4, students continue their clinical learning with some required and some elective experiences. Throughout these 4 periods of study, we have our courses organized into 5 strands. To keep it even easier, we're going to combine the first 2 strands into a single color, Human Biology and Disease, Illness and Injury. Let's briefly go over the individual courses within these strands. The first major strand is Human Biology. It begins with genes, molecules, and cells, a course that covers the fundamental concepts of cell and molecular biology, biochemistry, and medical genetics. As we all know, genetics is a rapidly exploding field, and figuring out and then teaching exactly what new doctors need to know is a challenge our faculty continually face. The next course is the Structure of the Human Body, which provides the first exposure to anatomy, embryology, and histology. Like many newer schools, FIU does not take the traditional approach of learning anatomy through cadaver dissection. Instead, this course uses plastinated and other specimens and incorporates virtual 3-dimensional models. The course director is an MD, PhD, anatomist who works with surgeons and radiologists to deliver material that truly relates anatomy to the practice of medicine. The third course is Integrated Functions of the Human Body, which focuses on physiology and immunology. Then, there is Pathology and Infectious Disease, followed by Pharmacology. These courses use a variety of teaching approaches from lecture to small group, laboratory, and case-based discussion. The next strand is Human Disease, Illness, and Injury, which goes throughout period 2 and is organized around organ systems. In April, period 2 students begin with cardiovascular and respiratory systems, and end in March with nervous system and behaviors. You'll hear these courses referred to as the organ system modules because each covers the core clinical presentations and major diseases of that organ system. The learning integrates each of these: anatomy, physiology, genetics and cellular biology, pathology and infectious disease, and pharmacology. The students learn through large and small group learning with case-based discussion as well as laboratory sessions. It should be noted that in the summer of period 2, the students have a 6-week break. Now that we've gone through the more traditional science courses of period 1 and 2, let's go back and fill in the other courses in periods 1 and 2. During the clinical medicine strand, students begin to learn very important communication skills in the Clinical Skills 1 course, which goes on for the entire period. These skills include basic patient history taking, patient-centered and empathetic communication, and motivational interviewing. Students also learn the normal physical examination and the elements of documentation. They practice these skills with the help of standardized patients, actors who are playing the role of patients. As part of clinical skills, students spend half day per month with a primary care preceptor in the community, so they have the opportunity to begin to practice histories, physicals, and documentation with real patients. Clinical Skills 2 picks up where Clinical Skills 1 left off. It includes 28 sessions that take place 1 to 2 times a week. In these small groups, students get to participate in hands-on learning with standardized patients. As the course progresses from Clinical Skills 1 to Clinical Skills 2, they learn how to perform a more focused history, physical and sexual examination, how to provide medication, oral presentations to colleagues, and how to handle more complicated and difficult discussions with patients, such as motivational interviewing and breaking bad news. At the same time students are participating in organ system modules and clinical skills, they have even more courses. The professional development strand focuses on the emerging MD identity. Health professionals are responsible for making numerous decisions while they provide care to patients. These decisions should be informed by the best evidence available from sound clinical research and patients' values and preferences. In the Period 1 course, Clinical Epidemiology and Quantitative Research, and the Period 2 course, Evidence-Based Medicine, the students begin to acquire the knowledge and the skills to find and use evidence in their decision-making. In the Humanism and Medical Jurisprudence Period 1 course, students learn to spot legal issues that commonly arise in delivering healthcare and consider humanism as it relates to themselves and to medical practice. In Period 2, students are provided with the fundamentals and policies that shape the U.S. healthcare system in a system-based practice course, followed by the end-of-life course, which is taught by physicians working in palliative and hospice care, ethicists, clergy, nurses, and social workers. Period 2 students have the unique opportunity to interact with practitioners from alternative therapies in the complementary and alternative medicine courses. The last component of the professional development strand is a course called Professional Behavior. In each period, students meet in small groups between 8 and 10 times with a faculty member to discuss case vignettes that illustrate the complexities of emotions, values, and attitudes in the healthcare setting. The course supports students in becoming reflective practitioners and helps them develop and apply emotional intelligence in patient care situations. The last set of courses running in Periods 1 and 2 are in the Medicine and Society strand. Period 1's Medicine and Society courses are Ethical Foundations of Medicine and Socioeconomic and Cultural Aspects of Health. They directly prepare the students for the Period 2 course, Community Engaged Physician 1. In the Period 1 courses, the students analyze clinical case studies that identify ethical concerns and consider broader policies in preparation for an ethical and socially responsive approach to medicine. They learn about the practice of other types of healthcare providers, such as nurses, social workers, and physical therapists. They then put this new knowledge into practice with the Period 2 course, Community Engaged Physician 1. Each student is assigned to one household in an underserved community in the Miami area and collaborates with the outreach staff and students from nursing and social work to improve health and wellness within the household. The Community Engaged Physician work extends from Period 2 into Period 3. This program is called the Green Family Foundation Neighborhood Health Education Learning Program, or otherwise known as Neighborhood Help. So, as a wrap-up, Period 1 and 2 are largely classroom-based, where students gain instruction in anatomy, physiology, pathology, professional development, as well as the social aspects of medicine and the social determinants of health. Students do get some initial clinical or hands-on training in these 2 periods, namely through the Simulation Center, emergency room exposure, home visits through the Green Family Foundation Neighborhood Health Education Learning Program, and monthly clinical experiences in the offices of family medicine practitioners. Period 3 is run quite differently from Periods 1 and 2. Period 3 is focused on full-time clinical training and is organized into clerkship rotations. This is a core rotation year where students spend time in specific clinical areas such as pediatrics or surgery. Students are given between 2 and 8-week rotations in a specific clinical area in varying order, beginning in April and ending in March. The students spend Monday through Thursday in the hospital and office settings. HWCOM medical students rotate through multiple inpatient and outpatient sites throughout South Florida. This provides students valuable exposure to different populations of patients and a wide range of medical conditions. This variety also provides students important perspective on how different healthcare systems function. This map highlights the locations of our clinical affiliates as of May 2017. On Fridays during the clerkship year, the students return to the FIU campus for classroom and simulation sessions. Most of these sessions are part of the clerkship the student is taking at that time. Outside of the clerkships, on 14 of those Fridays, students participate in the Core Concepts in Medicine course, also known as Osler Friday. This course has students working in small groups to solve cases with challenging diagnoses. 2 other sessions during the year focus on ethics and patient safety. These Fridays also allow students a chance to catch up with appointments and services offered on campus. They continue to visit their Green Family Foundation Neighborhood Help Household in Period 3 through the Community Engaged Physician 2 course, though less frequently. At the end of Period 3, students participate in an intensive OSCE session with multiple stations. They have to demonstrate core knowledge and skills at this point in order to move on to Period 4. In April, the students prepare to take the USMLE Step 1 exam, which will qualify them to enter Period 4. Because students need flexibility in Period 4 to prepare for the field of residency they've chosen, the curriculum here has more flexibility. All students will, however, complete between 2 to 8 weeks of advanced clerkships or sub-internships, as seen in the diagram, beginning with advanced medicine or surgery selective and ending with selectives, medical, surgical, or hospital-based specialty. They are also given 8 weeks of open time, which can be used to study for the USMLE Step 2 exam, as well as travel time for residency interviews. The students are also required to complete an approved research project over 8 weeks before graduation, though some take the option of completing it earlier. Period 4 ends in what is called capstone, which is a 2 to 3 week wrap-up training. This is followed by a boot camp that provides intensive preparation in the simulation center for internship. Then, towards the end of April, is graduation time. Meanwhile, students are still expected to keep up with their requirement for the Community Engaged Physician 3 course, otherwise known as the Green Family Foundation Neighborhood Help Program, by complying with visits and monitoring the household members throughout the year. Almost all courses have major end-of-course examinations. Here is a once-over of the other major tests our students take over the 4 years. Again, the all-important Step 1 takes place for them at the end of Period 3. And then just a few months later, they turn around in Period 4 to take Step 2. For those of you who might be interested in providing input to the education of our students, we would like to say a few words about our structure for managing and continually improving our curriculum. The most important piece of this structure is the Curriculum Committee, which oversees all educational aspects of the Doctor of Medicine program. Membership on this curriculum committee is largely determined by course directors and curriculum administrators. There is the opportunity for any faculty member to be elected to the curriculum committee by the faculty assembly. Now we are going to review the subcommittees of the curriculum committee, each of which oversees a specific area of curricular delivery or design and makes recommendations to maintain continuous quality improvement and ensure adherence to accreditation standards. Any faculty with an interest in participating in the curriculum committee or its subcommittees should contact the Associate Dean for Medical Education and Curriculum and provide recommendations to the curriculum committee. The assessment committee is made up of 5 to 9 faculty members from the 5 educational strands and the 4 periods of study. This committee evaluates the effectiveness of assessments. The Clinical Education Committee is made up of clerkship directors and assistant clerkship directors. This committee oversees the clinical education of all students, including the Clinical Skills 1 and 2 courses, the core clerkships, and Period 4 rotations. The Educational Technology Committee is made up of 5 to 8 faculty members and a representative from Information Technology. This committee assists in setting priorities for educational technology and provides recommendations to the IT Steering Committee, Curriculum Committee, and the Associate Dean for Curriculum and Medical Education. The Foundational Education Committee is made up of 5 to 8 faculty representatives and coordinators from Period 1 and 2. This committee assists in providing central management of curriculum for Periods 1 and 2. The Program Evaluation and Quality Improvement Committee is made up of 3 to 5 faculty representatives, the Director of Assessment and Evaluation, the Director of Accreditation, the Associate Dean for Student Affairs, and the Associate Dean for Curriculum and Medical Education. This committee provides a structure for program evaluation. The Strand Leaders Committee is made up of the Strand Leaders and Assistant Strand Leaders of the 5 HWCOM strands, appointed by the Dean, along with the Associate Dean for Curriculum and Medical Education. This committee oversees curriculum content and integration. If you are interested in training students in your office or hospital, or if you just want more information on our program, please contact the Director of Clinical Faculty Development or the Assistant Director of Faculty Development at comlearn@fiu.edu. Thank you.